Morning, everyone. How's everyone doing today? Good. Thank you guys so much for coming. My name is Bethany. I'm the dietitian with the Kidney Clinic Cornfield. I'm really thankful that y'all came today. I know your time is really valuable. So today we are doing our CKD Wellness Expo. And like I said, my name is Bethany, and I'll let Susan introduce herself.
Yep. My name is Susan. I'm with the Connected Care program. So you might have even seen a text from me at some point come across your phone. But Christina is our care advocate in the Connected Care Management program. And then you might have also seen a text from Margie. She is a sweetheart. She is in our General Care Management program. So or you might have talked to them on the phone, but we are real life people on the other end of those texts. So we're thankful to serve you in that program. And I'm glad all of you are here today because this is truly a journey and it's a lot of information to gather up along the way. I know personally I've learned a lot from Bethany as well. So I'm excited for you all to hear more about what she has to say, and feel free to jot down questions and things. And yeah, Bethany's a wealth of knowledge, so.
Thank you. Okay. I think I'm gonna go with this one.
Yeah, that might be better.
Okay. So these are the objectives for today's presentation. So you guys have a copy of the slides. So everything, if you can't read it on here, it's on the slides. And I made some little notes lines if you want to take notes on there. So I apologize. I know this isn't super clear and big, but this is the best I could do for first day.
You got glare on it. So.
The glare. I know. We try and close them all. Maybe if we close that back window. That's a little better. Yeah. That's okay. Thanks, Sarah. No. So by the end of the presentation, you should be able to describe the functions of the kidneys and how important they are in the body. Be able to define chronic kidney disease, which we abbreviate CKD, and then explain the connection between CKD, diabetes, and high blood pressure. Then we're going to talk about ways to manage chronic kidney disease, and that'll include some changes you can make to your diet to help preserve your kidney function. And then at the end, we'll talk about the available resources that we have at the clinic for you guys as patients. So first, we're going to talk all about the kidneys. So the kidneys are two bean-shaped organs located on either side of your spine, just below your rib cage. So they're on your back side, right below your rib cage, and they're responsible for filtering all of the blood in your body. And within each kidney, there's millions of little filters, which are called nephrons. So these nephrons are constantly filtering your blood 24/7. And the kidneys also help to regulate the amount of certain nutrients in the blood, including potassium, calcium, and phosphorus. So those are some words you may hear a lot when talking about the kidneys. They're also involved in the production of red blood cells. You may hear a lot about your hemoglobin levels when you're going to the kidney doctor. So kidneys are involved in that, and they also help to regulate your blood pressure. So as you can see, the kidneys have a lot of important functions, and they're closely connected with several other systems and other organs in your body, including your cardiovascular, your heart, your GI tract or your stomach, and your respiratory system, and also your immune system as well. So because of this, kidney health is really important for the entire functioning of the body. Okay. So now we're going to talk about what is chronic kidney disease. So chronic kidney disease occurs when the filters, those little nephrons in your kidneys, when they become damaged. So usually this is a slow process that happens over time. It's not typically something that just happens overnight. So the thing is, most people don't have any symptoms of chronic kidney disease until the later stages. So a lot of times people feel totally normal, totally good when you have those earlier stages of chronic kidney disease. And we'll talk about the stages in a second. But chronic kidney disease is usually evaluated using two simple tests. So the first one is a blood test. So when you go to the doctor and get your blood drawn, they'll always check your GFR. So you'll hear that number tossed around a lot. It also correlates with the percentage of your kidneys that are functioning. So sometimes you'll hear it called the kidney percentage, or your kidney function. So it stands for the glomerular filtration rate. So I don't expect any of y'all to be able to pronounce that. It takes a lot of practice. But it shows, that number shows how well your kidneys are cleaning your blood. And then the next test is a urine test. So that's the urine albumin creatinine ratio. And that test shows if your kidneys are leaking protein into your urine. That's another thing that you may hear from the doctor if they're talking about protein in your urine.
Is it, I heard that the urine is it'd be working good.
Well, that may not necessarily. So, if your urine is a dark yellow color, that could be a sign that you're dehydrated. So you really want it to be like a lighter yellow color. Yeah, lemonade is good.
Now with like the real orange color.
Oh, yeah.
But I'm doing it kind of drink one, so.
Okay. Yeah, so it can't, your urine color can change for different reasons, like certain medications can make your urine change colors. But in general, yeah, you want it to be that lighter yellow color, and that's a good sign that you're drinking enough water. And we'll talk about hydration too. Good question though. And then, so there are 5 stages of chronic kidney disease, and this is printed out in your slides. So if you ever need to go back and reference it, but it's stage 1 is going to be mostly normal kidney function with just a little bit of kidney damage. So that's when your GFR or your kidney percentage is 90% or higher. And then it goes down to stage 2, which is mild loss of kidney function. So that's when your GFR is between 60 and 89, which means 60 to 89% kidney function. And then next you have stage 3. So that's separated into stage 3A and 3B. So 3A is 45 to 59% kidney function, and then 3B is 30 to 44% kidney function. And so stages 1 through 3 are really considered the earlier stages of kidney disease. And then once you get down to stage 4 and 5, those are going to be the later stages. So you're having more loss of kidney function there. So at stage 4, it's 15 to 29% kidney function. And then stage 5 is less than 15% kidney function.
Does it matter how much urine that flows out?
So that can be a good thing to let your doctor know about if you have any changes in your urine, because, they look at the numbers and everything, but they also want to know what's going on with you, and, because everyone's going to be different. So that can be a good thing to tell the doctor, because in those later stages, you may not be producing as much urine. So that can be a change to let them know about.
Although it can't be reversed, can you stay at a stage?
Yeah, you definitely can. And sometimes people will see fluctuations in between the stages. So maybe one day you went and got your blood drawn, you were kind of dehydrated, and you saw this big drop in your kidney function. But then maybe the next month or 3 months later, it's gone back up to where it was before. So it's normal to fluctuate a little bit, but it's definitely possible to preserve kidney function. So that's what we're going to talk about too. So again, everyone's different, and it really depends on the cause of your kidney disease. But it's definitely possible to stay at a stage for several years or a decade. But yeah, that's also something to discuss with your doctor too. Okay, so some risk factors for chronic kidney disease include diabetes, high blood pressure, and family history of kidney disease. And then also kidney disease can occur just due to older age. So sometimes it's just something that you can't control when you get older. Stuff starts to not work as well. So the same goes for kidneys too. They can decline a little bit as you get older. So these are some symptoms of chronic kidney disease. And like I said, a lot of times people don't have any symptoms until those later stages. But if you do have any of these symptoms, it's important to talk to your doctor about it so they know what's going on and know the best plan for you. But you'll see changes in urination as one of those on there. But also, since the kidneys have so many important functions, as the function goes down, you can have problems controlling your blood pressure or having low hemoglobin or anemia. So those are some things that can happen. But the good news is when chronic kidney disease is found early and properly treated, and you're proactive about it, which you guys all are because you showed up today. So the outlook can be very good, and it is possible to preserve some kidney function. So now just wanted to talk about how diabetes, chronic kidney disease, and high blood pressure are all connected. It's a really important connection here. So diabetes is the #1 cause of chronic kidney disease. So basically, when you have diabetes, you have these extra sugar molecules in your blood, and it causes your blood to be kind of thick. So if you picture your kidneys, they're filtering out all your blood. If they're having to process this really thick blood, it makes them have to work harder and it can cause damage that way. So diabetes, big risk factor for chronic kidney disease. Diabetes also increases your risk for heart disease and stroke. And then people with chronic kidney disease are also at higher risk of heart disease. So it's all kind of interconnected. And then the #2 cause of chronic kidney disease would be high blood pressure. So if you picture your blood flowing through your kidneys, a normal gentle flow of blood is kind of like a water hose worth of pressure going up against your kidneys. But when you have high blood pressure, it's kind of like a fire hose going up against your kidneys. So it causes them a lot of stress and it can damage those little filters. And then the health impact is greater if you have multiple of these conditions. So if you have diabetes and high blood pressure, then both of those can combine and kind of accelerate the damage to your kidneys. So it's important to kind of figure out, if you do have these conditions, which one likely caused chronic kidney disease, and that's where you can really put your focus on what you're going to control and what you're going to manage to help preserve kidney function. So just wanted to touch on this quickly, and so you can know that you're definitely not alone. These conditions are really common. 37 million Americans have kidney disease, so it's a huge problem that is just continuing to increase over time. And a lot of times people don't know they have kidney disease because, you don't have any symptoms. And so it can really be a big issue. But over 11% of the population has diabetes, and 1 in 3 adults with diabetes likely have kidney disease. So you can see how those are all connected. And almost 50% of adults, so half of all the adults in America, have high blood pressure. And then 1 in 5 adults with high blood pressure may have kidney disease. So you can just see how staggering the numbers really are, and know that you're not alone and there's a lot of other people going through the same thing. Okay, so now we're going to get into the fun stuff of how you can manage chronic kidney disease and diabetes and high blood pressure, and hopefully preserve some kidney function. So why is it important to manage these conditions? So preventing or managing one condition like diabetes, high blood pressure, or chronic kidney disease can also help prevent or manage the others. So if you're able to control diabetes and high blood pressure, then in turn you're going to be managing your kidney disease and preventing any further decline there. On the other hand, if your high blood pressure or diabetes are uncontrolled, then it can lead to worsened kidney function, like we talked about there.
And then when they go on dialysis and stuff.
So if you think back to the stages of kidney disease, at stage 5, when your kidney function is 15% or lower, that's a lot of times when the doctor may start talking to you about dialysis. They'll probably start talking about it at stage 4, but stage 5 is when you need to be considering it pretty strongly, because once your kidneys get below that percentage, it's really hard for your body to keep up with everything. But it also has to do with any symptoms that you're experiencing too. So some people don't have to go on dialysis right away. They still are able to keep going without it. But yeah, stage time.
Maintain keep your blood pressure in check and your diabetes in check. You know, just seeing how many some kidney problem.
Yeah.
Cause any good from kidney.
Yeah, and everyone's different too. So like sometimes when people get to stage 4, they start having a lot of swelling and they're just not feeling good. They have a really poor appetite and just feel kind of sick all the time. But then other people, feel totally normal. So it just depends on what's going on. Yeah. Okay. So the first thing that you can do to manage your conditions is medication management. So I was hoping we'd have our doctors here to make a special appearance and talk about this, but I'll speak generally about it. So medications are often prescribed to control blood pressure and or reduce protein in your urine. So I put some examples of medications that you may take or you may see in the future for blood pressure and protein in the urine. So those include things like lisinopril, losartan, hydrochlorothiazide, and amlodipine. Okay, you got the whole concoction there. So those are some really common ones. And then for diabetes, medication can help regulate your blood sugar levels and prevent kidney damage due to high blood sugar. So some common ones for diabetes would be like metformin, glipizide, Januvia, Jardiance, Ozempic, and insulin.
But I think that.
Okay. Okay. Yeah.
Some say that metformin is not good for you to take.
Yeah. So with that's another good thing for the doctors to discuss. But with lower levels of kidney function, they may take you off metformin and switch you to something else. But in the early stages, it could still be okay to continue with metformin. But that's another good reason, to bring your medications to your kidney doctor and make sure you at least give them an accurate list of everything. That way they can make the best decision for you on that. So, these medications help to control those conditions and therefore can help prevent kidney damage. So if you skip doses or stop them without talking to your doctor, then that can worsen kidney function and increase the risk of complications. There we go. Okay. So now we'll talk about the kidney-friendly diet. So this is my area. So what does the kidney-friendly diet do? So it can help to manage your blood pressure and your blood sugar. It can help balance the electrolytes in your body. So that's like your sodium, potassium, phosphorus. And then it reduces strain on the kidneys by limiting the intake of certain substances that need to be filtered out. A big one is protein, and then another one is sodium. And it can help slow down the progression of chronic kidney disease and even preserve kidney function. So just wanted to give this disclaimer, the kidney-friendly diet is different for everyone. So the best diet for you depends on several factors, including your lab results, your chronic kidney disease, what stage you're in, any other medical conditions that you have, your height and weight, and then also any medications that you're taking. So today we're going to discuss the basics and the general recommendations. But if you are wondering if something applies to you, I would recommend setting up a one-on-one appointment with me. I'm happy to talk with any of y'all. You can also ask a question and I'll try to answer it as best I can without knowing your whole medical history. So here are the basics of the kidney-friendly diet. So this first one you've probably heard of. A lot of doctors will go ahead and recommend this. It's really good for anyone with kidney disease, anyone with high blood pressure. It's going to be a low sodium diet. So the goal for this is usually to keep sodium intake around less than 2,300 milligrams per day. And this is going to help to make sure you have normal blood pressure levels. So if you're looking at nutrition facts labels, and I have a few examples here, it's going to be good to keep your meals less than 600 milligrams of sodium and then your snacks less than 200 milligrams of sodium. So this gives you enough for 3 meals and 2 snacks per day. Doing the math on that. So for sodium, I brought us a few food products to check out so you guys can see those. Hopefully it's light enough in here. So big one that everyone talks about is always canned food. So a lot of doctors or people will say, you know, you can't eat anything in a can. And I've talked to people and said, I haven't had canned food in 20 years. But the good thing about canned food is it's really convenient and it's cheaper. You know, it stays in your pantry a long time. So I just wanted to show you guys an example of how you can use canned food. So this first one is a regular can of corn. And then I brought you guys the no salt added corn, so you can see how big of a difference in between the two. So do you guys know where to find the sodium on a nutrition facts label? Okay, so if you want to pass those around, you can see the difference between the regular corn and the no salt added corn. So what's the sodium on the regular corn?
Regular corn, it is 320 milligrams from 14%.
Oh yeah, so 320 milligrams of sodium. That's a good bit when you're trying to keep it below 2,300.
Yes.
But if you look at the no salt added, what does it say on the no salt added corn for a serving? It'll be in that left column next to the sodium.
10 milligrams.
10 milligrams, so a huge difference there.
Yes.
Yes, ma'am.
Even though mine says low sodium, I take rich mine, beans under the water, you know, but go the can for about 3 times. To get rid of even the low salt.
Yeah, so that's another thing you can do if you're doing the canned beans, which are another.
Do that too, I miss.
Yeah, that's a really good idea. So even if it does have a little residual sodium on there, or maybe you were able to find the low sodium ones, but you're still trying to watch things, you know, rinsing them and draining them can be a good way to get the sodium off as well. But that's just a good example of how, you know, if you are going to do canned foods, you definitely can just want to look for that no salt added label on there. And so the only sodium that's going to be in there is just what's naturally found in corn.
Raw salt is bad.
Raw salt, like sea salt?
No, just drink it, after you mix it up and then you sprinkle it on that.
Rather table salt.
Table salt.
Table salt. Yeah, so it's basically all going to count towards that sodium level. So there's table salt, there's sea salt, pink salt. It's all just basically different types of salt. So Mrs. Dash is really good because there's no salt in that at all. There's no salt substitutes, no salt. So it's just a blend of herbs and spices. So yeah, so Mrs. Dash is a really good one if you like the flavor of that. But basically a teaspoon of salt is this 2,300 milligrams. So if you have, you know, 1 teaspoon of salt for the whole day, then that's that number right there.
20.
Yeah, so you can see how that can add up pretty quickly. But the good thing is, you know, if you're cooking your food at home, it's a lot easier to control that salt level versus if you're going out to eat or maybe getting fast food. A lot of times you can see those numbers and, you know, they're pretty high. Maybe it's a meal has 1,000 milligrams of salt. So you can see that's, you know, half your intake for the day. Do you guys have any questions about sodium or salt?
Yes.
Yes,
So-
sir.
What do the salt actually do to fitness?
So the salt, when you eat too much salt, it raises your blood pressure, and then that's going to be putting that extra stress on your kidneys. Yes, sir. So, and your kidneys are also filtering out salt out of your system too. So it's both of those. Does that answer your question? Okay. Yes, it makes.
I've been using bouillon to season my food for quite a long time.
Uh-huh.
And I don't know how to find, or where if they even make it something that doesn't have so much bouillon, but this has the beef flavor, the chicken flavor and stuff like that. Do you know of any such product on the market?
They do make some, I think it's salt-free bouillon. They do make them, but I think it may be something you have to find online, like on Amazon or something. Do you ever do any online shopping? Or not really?
I know I can get my daughters to do it.
Yeah, I would look for I think they make a salt-free chicken bouillon flavor, so it just has like the chicken flavor. But yeah, I can double check on that. I'll pull something up on my phone and I'll let you know at the end.
Appreciate that, because, you know, really, you need a little seasoning in some of that stuff.
My neighbor's food is for birds. I need to drink.
Which food you said was for the birds?
Fresh. Fresh, they don't have no fear, no nothing. The birds might even try with them.
So, you know, the way to get around that really is by cooking your food at home. And, you know, if you're putting a little sprinkle of salt, you're gonna stay under this 2,300 milligrams. But, you know, if you gotta go out and get food, then it's gonna add up a lot quicker. But, you know, sometimes you just have to get creative with the different seasonings and flavors. So, you know, you can add lemon juice or vinegar or lime juice or any types of spices you like. They're all good for the kidneys. It's just that salt that you want to limit. Okay, so good questions there. But yeah, so after sodium, probably the next most important thing would be the protein in your diet. So this is the exact amount of protein in your diet depends on your body size, your medical conditions, and your stage of kidney disease. So for most people, a low protein diet is going to be recommended because your kidneys are also filtering out protein out of your system. And if you're eating an excess amount of protein, then they're having to work kind of hard to filter that out.
I love cheese,
Cheese. So cheese can be a little tricky because it has protein and then it also has potassium and phosphorus, which we're going to talk about on the next slide. But you know, including the small amount of it in your diet is possible. It's just important to think about the serving size too. But protein is in things like dairy products and meat like chicken, fish, turkey, beef, eggs, and then there's also plant-based protein, which is in things like tofu, beans, lentils, nuts, seeds, and whole grains, like brown rice or wheat bread. Those have plant-based protein in them. So, oh no, that's not what I'm going for here. No, we're going to talk about the things that you can eat too, and these are some really good ones. These plant-based proteins. So, hello. So these plant-based proteins are really good to include. So there's been a lot of research done on the different types of protein, and we found that the plant-based proteins are actually easier for your kidneys to digest than the animal proteins. So if you are trying to be easier on your kidneys, doing more plant-based proteins is going to be really helpful. So for example, a lot of times when people are trying to eat more plant-based proteins, they'll do like a meatless Monday, one day a week, where instead of having meat for dinner, you have maybe some beans or some tofu instead of that animal product. But yeah, those are it's definitely good to include. Do you guys have any questions about plant-based protein? Vegetarian. So some people do choose to go fully vegetarian, but you know, even if you make a small step towards that, like just one day a week or one meal out of the week, you're doing that, it's still going to have an impact. So it doesn't have to be 0 or 100. You know, you can fall somewhere in between those two. Yes, sir.
There's one animal protein. I know it. All is not good for you, but it's one actually a little bit better than the other one. So maybe chicken.
Yeah. So as far as the kidneys go, really all the animal proteins are going to have a similar impact, but with the different meats, you really want to think about the impact that it's going to have on your heart. So, you know, as we talk about, the heart and the kidneys are really closely related. So some of the meats that are higher in saturated fat, so like red meat, or, you know, a real fatty cut of pork or something like that. Those are the ones that you want to limit due to their saturated fat content. But, you know, if you're buying meat, you want to just try and get the leanest meat possible.
Good too. You haven't done that. I live with my sister and brother. We like pork.
Okay,
And you spoil it, put like a little cap full of vinegar in it. Yeah, something or.
I mean, it would help flavor it definitely, and probably tenderize it.
There's certain meat have higher protein than other meats, like poultry, beef, pork.
They're all
Which one have the highest
the highest
protein?
protein content. They're really all pretty similar, like between those per ounce, between like 6 to 9 grams of protein per ounce. So it's really, when you're doing the low protein diet, you just want to watch your portion size of protein. So I'll give an example of that here soon, but as I said, the exact amount is going to depend on your individual situation. So if you need to know the exact number, definitely we can set up an appointment. I'll calculate it for you and we can plan everything out. But in general, you want to keep your meat, your protein portion to like the size of a deck of cards or like the size of the palm of your hand. And that's about 3 ounces of protein with your meals.
So chicken, if you boil it, like take it off, but take the skin, cause I don't like boils.
Okay.
I like my.
Fair.
But if you boil it, just take the skin and most of the time when I clean my chicken,
Mhm.
I pull the fat off of this on the side.
Yeah.
So, and then pull it off the bone and, like that, so.
Yeah.
That's good and stuff like that.
Yeah, because the skin and that white fat you see on it, that's where a lot of the cholesterol and the saturated fat is. So, if you can trim all that and get rid of it, then you're saving a lot of saturated fat.
When they said, well, babe, it's a chicken, but no, you don't kill it. I really did. Don't actually did.
You said she would bathe it?
Yes, he was.
Jeez.
I don't know if he don't use the dishcloth, but he's standing in the running water like she did for bathing that. It's a chicken.
I know, and I know there's a big debate on whether you should wash your chicken and things like that, so we won't get into that.
Bethany, when thinking about beans, so some patients, especially when they are advanced in kidney problem or disease,
Mhm,
they have some restriction with phosphorus.
mhm.
So beans, I like it, and many people like it, but we have probably issues with the amount of phosphorus that they have. So some alternative for that.
So, the good thing is, and we can go ahead on to phosphorus now. Or next was potassium. We'll skip to phosphorus. So, with phosphorus, so phosphorus is found in any food's protein. So it's in meat, and then it's also in those plant-based foods. But there's different types of phosphorus in these foods. So in the first type, there's the organic phosphorus. And I'm going to answer your question. I'm sure
Don't worry.
I'm going to explain everything.
It's fine.
I'll get you your answer. So it's naturally found in foods with protein. And so on the spectrum, meat foods with phosphorus, the body is absorbing about 60% of that phosphorus. And then less than that, you have your plant-based proteins like your nuts, beans, and grains. The body is really only absorbing about 40% of that phosphorus. So it's not bioavailable in the body, and the body's only absorbing a small amount of it. On the other hand, you have this inorganic phosphorus. So this is the type that's added to foods as a preservative. And I'll show you some examples of that, but this type is about 90 to 100% absorbed by the body. And it's really recommended that everyone with chronic kidney disease should avoid this type of phosphorus. So if someone's having high phosphorus levels and they're in the later stages, I would first look at this inorganic phosphorus, see if we can find some sources of that in the diet, because a lot of packaged foods do include this inorganic phosphorus. And then if they're still eating meat, cutting back on eating meat and doing more of the beans, less phosphorus is going to be absorbed that way. So it would just require, Dr. Almeida, just a little more planning, but it's definitely, out of all those options, beans are definitely still going to be the best one, even in the later stages. And then, if they still got to eat something, so, if they have to do a phosphorus binder or something like that, then that would probably be the next step. So I'll show you guys some examples of the different kinds of phosphorus too, so you can see that. But I also wanted to talk about potassium. So potassium is another big one that gets talked about a lot. So the amount of potassium you eat is going to depend on your lab values. So again, it's one of those things that's kind of different for everyone, but I put some general recommendations here. So typically, if your potassium level is normal, so we used to think that everyone with kidney disease had to follow a low potassium diet. So you couldn't eat bananas, tomatoes, avocados.
I love good salad with tomatoes, but in your low banana, but I eat banana too. But I love tomatoes,
Yeah,
fresh tomatoes, and so is that good or bad?
I'm gonna get to that. So we used to think that, everyone had to avoid all those foods, but now we know from research that potassium has a lot of other beneficial effects in the body. And all those fruits and vegetables with potassium, they have so many other benefits. And the last thing we would want you to do is eat less vegetables because you're trying to eat less potassium. So typically, if your potassium level is within the normal range, and that's something, that you get checked on your blood work every time you go to the doctor, then you don't need to limit your intake of potassium from those natural sources, because they can actually have beneficial effects on your blood pressure, helping to lower that. But if you're in this high potassium range, so if you go to the doctor and the Dr. Almeida tells you your potassium is high, then that is likely a sign that you may need to limit, the intake of some of those, like the tomatoes and avocados and bananas.
What about grapes?
Grapes would be considered like low potassium fruit. Cabbage is lower in potassium. So the thing with potassium is it's basically in every single food. So you're never going to be able to avoid it completely. So really, if you're it's important to look at the portion size, because you can take a portion size of low potassium food like grapes, and if you end up eating the whole bag, then you just had a high potassium food because you ate so much of them. But
The whole bag.
oh, I know, that's just
Yeah, I don't even that, but yeah.
yeah.
Perhaps 6 every other day or something like that.
Yeah. And then another good one, is an example with the tomatoes. So, if you're having just a slice of tomato on a sandwich or, some diced tomatoes on a salad, that's a whole lot less than if you're having a jar of spaghetti sauce and, having that because it's more concentrated. But yeah, if you are having problems with your potassium or if you're having questions, that's a good thing that I can definitely help you with, because I can give you, an exact amount of potassium to be eating, and we can do some planning there on, maybe how many high potassium foods you can eat in a day or in a week or something like that. But there are some other causes of high potassium, so it's not always because of your diet too. So there's some other things to look at there as well. And then sometimes your kidneys are actually filtering out more potassium, and you can have low potassium levels. So that can sometimes happen too. And if that happens, then you probably need to eat more foods that are high in potassium. So it can really be anything on that range. And so similar to phosphorus, there's actually 2 types of potassium as well. So there's the potassium that's naturally found in pretty much all foods like fruits, vegetables, whole grains, and beans. So this natural form of potassium, the body really only absorbs less than 60% of it. So it doesn't affect your potassium as much since the body is not absorbing all of it. There's a second type of potassium, which we call potassium additives, which are added to foods as a preservative. So it's just like the phosphorus additives, they also do potassium additives. And these are highly absorbed by the body. So if you eat too much of these, they can make your potassium shoot up really quickly. So this is really the type that you want to stay away from, even if you have normal levels, just because it can build up. So I'm gonna show some examples. We can go on to
Right on this yellow.
Oh, I'm sorry. I should have brought the magnifying glasses. Well, this is gonna be even smaller. You probably won't like this slide. So, I took some copies of some food labels here, so to show you guys some examples of the added potassium and phosphorus. So so these are the examples of the preservatives that they can add to food. And so these are really highly absorbed by the body, so they can really affect your blood levels of potassium and phosphorus. So this first one on the left, it is it's a cola, it's a dark soda. So you can see in the ingredients, it has potassium benzoate, and then in parentheses, it says as a preservative right here. And then it also has phosphoric acid. So those are two really common ones that are added to a lot of drinks, especially dark sodas. Pretty much every single soda has these two preservatives in it. So a lot of times, you'll hear the recommendation, stay away from dark sodas, and that's why. Tea, a lot of the bottled teas, if you're getting like Lipton, the diet teas and stuff like that, they will sometimes have those additives too. But if you're making your tea at home with tea bags, it's not going to have any of those preservatives. So basically, those preservatives allow it, a bottle of cola or a bottle of tea to sit on the shelf for 10 years and, not go bad because it has preservatives in it. So that's in general just one that's good to kind of avoid there. This next one in the middle is an example of bread, like a sliced bread product. So you can see in the second to last line, it has monocalcium phosphate. So anytime you see the word phosphate or phosphorus or anything with the PHOS, that's a sign that it has added phosphorus in it.
So that's big.
Yeah, that's the kind you want to stay away from. But the good thing about these packaged products, like the bread and any like crackers or anything like that, is a lot of times you can find another product that's similar where the company just has chosen not to use those preservatives. So it's
Taking all our time in the grocery store reading.
I know it definitely takes a little time to figure out what you like. But that's another thing, I can help with on that end too. If you need some certain product ideas or something like that, I'm happy to share some things that I know about. But another thing is, they can change the ingredients at any time. So it requires some continuous looking at the ingredients to make sure it doesn't have anything in there too. And then the last one is an example of some coffee creamer. So this is a big one that gets a lot of people. If you're having high potassium or phosphorus levels, a lot of times they can be because of coffee creamer, because they use this dipotassium phosphate. So it's an additive and they combine potassium and phosphorus. So
Read up on this.
got both of them in there. So if you are having problems with that, a lot of times it can be better to just use like regular milk because it's not going to have those additives in them. But like I said, there's also some brands that choose not to use those additives in their coffee creamer. So it is possible to find some different options too. And if you ever feel like you don't have options, definitely come to me because I can help you find some. Do you guys have any questions about these labels? Okay. I brought an example too, so you can see what it looks like on the label. This is some cheese, but it's shelf stable, so you don't have to refrigerate it. So it has a lot of preservatives in it. So if you want to see on there, you can see the different phosphorus preservatives in the ingredients. Okay, so now we'll talk about how you can put these things together and, plan out your meals and make sure you're having the right portions of everything. Oh, I forgot to add in the packets, I included two handouts, one on potassium and one on phosphorus. So it has some food lists in there. If you ever find your name. Oh, no, at the end of the slides, I've stapled it on there. So,
Oh, okay.
yeah. So if you ever find yourself in a position where, you're wondering which foods are high in potassium and which ones are low in potassium, I included a list for you on there. So, when you're planning your meals, it's good to include more fruits and vegetables and more whole grains and also more plant-based proteins. So can someone name an example of a whole grain? Yeah. So whole grains would be things like brown rice, yeah, wheat bread, and also there's whole grains like oatmeal, it's a good one for breakfast, and then also some ones that you may not have heard of, like quinoa, things like that, are whole grain foods. So they have a lot of beneficial effects in the body. They have a lot of fiber in them, which is good for your heart and good to help keep you regular. So those are always good things to include. And then also those plant-based proteins that we talked about. And then it's good to have less salty, less fried foods. You know, that's always going to be a good thing. But for meal planning, I usually like to recommend the plate method. Has anyone ever heard of that before? No? Okay. Yeah, so I included the very last page in the packet is one on the plate method. Yep, so it's a good way to plan your meals without having to measure anything or to weigh anything or anything crazy like that. So if you picture your dinner plate or your lunch plate, and there's a picture in there for you, you want to try and make half your plate vegetables. And so vegetables, they fill you up, they have a lot of nutrients in them, they have a lot of fiber, so you really want to fill your plate up with vegetables. And then the other half of your plate, a quarter of that, you want to make it your protein. So that is either your chicken or your fish, or if you're doing the plant-based protein, you just want it to be about the size of the quarter of your plate. So that way you make sure you're not getting too much protein. And then the last quarter of your plate, you want that to be your starch or your carbohydrate. And so, as you can see, it's good to do more of those whole grains. So when you pick out your starch, it's better to do like the brown rice or wheat bread or like a wheat dinner roll, things like that, and just have it take up about a quarter of your plate. And there's some examples on the handout of that. Does anyone have any questions about the plate method? You look skeptical over there.
How large is the plate? How large is the plate?
How large is the plate? Usually, yeah, not like a serving tray, but usually a dinner plate's like around 9 inches, 9 or 10 inches.
Also, should we have done about it? We could have prevented something.
What's your question?
Also, we could have done something about our kidney. Then maybe we could have prevented or some kind of blood work could have been done, or it could have prevented some of this from happening.
Yeah. So a lot of times, and maybe Dr. Almeida, if you want to talk about this, since it has to do with blood work. But every time you go to your primary care or to your kidney doctor, they're checking your blood, right? Or at least every 3 or 6 months or every year. And so on that test, there's the GFR, like we talked about, the kidney function test. So sometimes and this is a huge problem across the whole country. So sometimes primary care doctors they don't say anything, or they don't refer you to a kidney doctor until that number gets below a certain number. So like below 60 is usually when they're like, okay, now you need to go to a kidney doctor. So that's one thing that we as a company are trying to change that, but it's going to take a lot of people working together to try to increase the amount of people we're identifying with kidney disease. So yeah, that's why it's always good to look at your labs and tell your family members about it. Make sure they're always looking at their labs and making sure their GFR number is good. Because if you see it going down, then that would be a good sign to get with the kidney doctor, or
How the GFR will be, or what the number.
So
60 is more than 60 is considered normal. 16 meals per minute, yeah.
60 or 16.
60.
Okay.
Yeah.
but,
Anything below 60 bad. I'm getting it.
Well, if it's closer to 60, you have less problems. If you are close to 15 or 10, you are in trouble, yeah? Because when you have these really low filtrations, you may need dialysis, that is the option that we have, or kidney transplantation also. So the idea is that when your doctor do your test, you can ask your doctor, okay, how is my kidney function, for example, yeah? You don't need to know exactly EGFR or creatinine, that is the marker that we use. Basically, you can say, okay, I had any problem with my kidney function, or I am spilling protein in the urine, or I have some blood in the urine. Same thing with different organs in your body, like a liver. So how are my liver function tests? Yeah. So you don't need to be very specific regarding what is the marker that you are looking, or the doctor is looking for. But in general, if you ask for that, the doctor need to check your creatinine, your EGFR, and also your urine. Okay.
So basically, the doctor, medical doctor should, what you're saying, you say you're all trying to go across the board where it's sooner than waiting until it gets to a certain number. That
Yes.
once it starts reaching that number before, something should be said. Right?
yeah, that would be the
You know, as
ideal.
we all get older, we're all gonna have some functional kidney
Decrease,
disease.
yeah.
It's just inevitable about getting older and what we do. What's important and what we now have the ability to do is to intervene and through people's health like Bethany and Dr. Almeida, we can delay the progression of the disease.
You get some medication, you get paid.
It can be medication, but it'd be as simple as something as your diet,
Yeah.
weight, Dr. Almeida, knowing your history or your family and what genetics issues possibly we can deal with. There's a lot we can do that's more, I'll call it preventive, but certainly that we could slow the disease progression. Our goal as a company is that we've all heard of this. Our goal as a company that never set foot in this. I hope that's a lot of it. We have never set, and what we're doing now in education like this and teaching you aware of that, Brittany brought up the primary care doctors. We're working in coordination with Dr. Stevens, Dr. K, Care Connect, all these primary care doctors. We've got the ability to work with them now to identify people such as yourselves who might have a chronic kidney disease and don't necessarily have the signs and symptoms yet, but what they can do is then work with Dr. Almeida. They can then have you, and I'll let Susan talk about this. Our program is called Connected Care, and that through your phone, you can talk to Bethany anytime you want, not just call her, but you can get to her. She'll send you a link. If you got a question about specific food, or you're at the store, or ask her that. If you don't know, you're able to get with her. You can also talk with the doctor. We have what's called care advocates who are available to you just about 24 hours a day, 7 days a week. And I don't want to get ahead of it.
Oh, yeah. No, thank you for adding that. 'Cause, yeah, we talked about in the beginning about prevention and also the tests used to identify kidney disease. So thank you for those ads. And then at the end, we'll talk about the resources, and we'll have Susan talk about connected care at the end too. Okay, so back to meal planning and portion control. So as I said, it's good to cook meals at home whenever possible, just because you have more control over what you're putting into your food. And so a lot of times when people are trying to follow a more kidney friendly diet, they'll start trying to eat more fruits and vegetables, which is always a good thing. So one way to do that is trying to incorporate fruits and vegetables into your snacks throughout the day, such as having like an apple and peanut butter as a snack. And that way you can increase your intake of those.
What if you don't have a snack? I don't eat in between. eat breakfast, which is sometime about 12. Then I eat myself like 5:30.
Okay.
Then at night, I have maybe like, some grapes,
Uh-huh.
like that, but, that's all I eat.
Okay. Well, yeah, I mean, if you're not a snack person, then, that tip wouldn't really apply to you. So you would have to work to include more fruits and vegetables with your meals then. Yes, ma'am. Yes, go ahead.
I like peanut butter and jelly sandwiches, so
Yeah.
it got some peanut butter and the sugar-free jelly. Is that all right or not?
Yeah, that's okay, because peanut butter has a good amount of plant-based protein in it, so that could be a good meal or a good snack. And yeah, if you're trying to control your blood sugar, the sugar-free jelly can be a good option.
And how many slices of bread?
There's no certain.
Brown bread, that's just like bread from bread.
Yeah.
I can live with it.
And, for myself or something, like you have some vegetables, have to have cornbread.
Mhm.
I eat small pieces because I don't like cornbread, but I eat a little piece of it.
Yeah.
But, I like bread,
Uh-huh.
with sandwiches and stuff like that.
Yeah, well, it's really all about moderation, and there's no specific, slices of bread that you should eat a day. But yeah, I mean, if you're having a sandwich with your lunch, I mean, that's a reasonable amount of bread. You just, you don't want to sit down and have half a loaf of bread.
That's why I agree with that, but I don't
Well,
like.
that's perfect.
I don't have-
You can't get any less than that, right? Or else you would be having a sandwich.
Yeah. But I'm really not a big bread eater.
Okay. So yeah, when you do have the bread, if you can have the wheat bread, that's gonna be a little better for you. But, really, it's all about moderation too. And it's important to look at the big picture as well. So, if you have one day where you had to go out or, you took a trip or something and you had to eat something that wasn't necessarily what you were planning on, it's not going to mess up everything that you've been working on. It's important to look at the big picture too. Okay, now I just want to talk about a little bit about hydration. I know we talked a little about it earlier, but in the early stages of kidney disease, it's important to drink plenty of water because this is going to keep you hydrated and maintain your kidney function. However, in the later stages, you may need to start limiting your fluid intake because your kidneys, are processing that fluid, and sometimes they, as the function goes down, they're not able to keep up and process all that fluid. So it's important to ask your doctor how much fluid you should consume, or if you have any restrictions around that. Some signs that you may need to limit your fluid intake would be if you're having any like swelling in your legs, or in the morning when you wake up and your face is kind of swollen. Those would be some signs that your body is holding on to too much fluid, and would be good to talk to your doctor about that as well.
So long as that's sweating on your feet, and you good.
Yeah, and so there can be some other signs too, like if you're having trouble breathing, or if you're having high blood pressure, those could be some signs that you may be drinking too much fluid. But yeah, and then like you mentioned too, it's important to look at your urine color and make sure it's not, too dark or too light there too. But yeah, if you have any questions or concerns, that's always a good question for the doctor too.
Excuse me.
Yes, ma'am.
You said like your face is swelling.
So sometimes you can have swelling around your eyes because it's the tissue that is a little more like, or has less, you don't have any, or you have too many muscles or anything else there. So sometimes people with kidney disease that are spilling a lot of protein in the urine, in the morning, you can have puffy eyes, yeah? So, but you can have these puffy eyes because other things, like if you have sinuses, or if you are in Vegas and you are not sleeping well, and all these kind of things, so you need to take what is happening in a very kind of individualized way, because not all the signs are the same for all the patients. But in general, obviously, if you have swelling in your legs, you probably are using too much salt or you are using too much fluids, yeah? Especially if you have some issues with your kidneys or with your heart. Remember, people with heart failure is a condition where the heart is not pumping well or relaxing well. They have the tendency to retain fluids. And you can have these big amount of fluids in legs. And before getting or seeing the swelling in your legs, the first thing that happens is your weight is going to start to increase. So some patients need to weigh every day in order to be sure that they are not retaining fluids. When you have already swelling, sometimes it's too late, okay? And the other part that I like to add, when you have a kidney problem, most of the time you don't have any symptoms, so you don't feel anything. Maybe you can have issues with your blood pressure, you can have issues in your test, but if you don't go to the doctor or you don't go and do some blood or urine test, it's really difficult to tell you that your kidneys are working well. So the idea is to work closely with your primary care doctor, and if you have any question, ask them. If you are working with our plan or the chronic care plan that we have with the company, you are also able to contact somebody that can explain or can direct you to do some things, yeah? So important things, always try to do or try to have a referral early to the doctor, to the kidney doctor if you need it. As any problem, you know, as any problem, if you have a heart issue, sometimes you need to go to the cardiologist. Now, how fast or how early your doctor send you is going to be, or is going to depend how comfortable he is or she is managing your condition. Because sometimes the primary care doctor, they like to manage, for example, people. We have 5 different levels of kidney like a function in chronic kidney disease. Sometimes they are able to manage you in stage 1, 2, and early 3. Sometimes they prefer to send you early to the kidney doctor, and it's okay. So it's not wrong or right. It's basically depending on every like a situation, and every practice is different. So when you need help or when your doctor needs help, we are there to give your doctor or you a hand, okay? And it's important to be proactive, because sometimes we wait that the doctor, the nurses, sometimes the insurance companies even have some person that can call you and can ask about your sugar, your blood pressure. But if something is not going well or you don't feel well, you need to be proactive and ask for an appointment with your doctor, call the office. Something is not going well, my medications are not working, I'm retaining fluids. So all these kind of things are important, okay? Sorry.
Okay, thanks, Dr.
Thank you.
Yes, that was great, and we'll talk more about that in just a second too. So yeah, as far as hydration goes, I just want to say one thing about coffee, because that's a common thing that people ask about a lot. So the general consensus is that it's safe in moderation. So if you're drinking like 1 to 2 cups per day, then it's going to be okay for your kidneys. You just want to consider what you're adding to it. So
Look at agree with this.
so that's what you're saying. So there's one creamer. So a lot of the coffee mate creamers, they use those potassium and phosphorus additives. There is one that's called the Natural Bliss creamer. It's like in a white bottle with blue letters. Last time I checked, they were good. They weren't using any potassium or phosphorus additives. But if you are worried about that, even just putting like a splash of 2% milk or something is going to be better. Yeah, than using one of those creamers with all those additives in them. So just wanted to talk too about some other lifestyle changes that you can make to help with kidney disease. So any type of physical activity, exercise, that's going to help improve your blood pressure, your blood sugar. It can also help with your cholesterol levels. It's also going to keep your muscles and your bones strong, and it can also help with your sleeping habits. So, even for physical activity, you don't have to be running a marathon, even if you're doing some walking around your neighborhood or around your house. That's going to still have a beneficial impact for your overall health and for your kidneys. And then also just wanted to talk about sleep and stress management. So lack of sleep or increased stress can affect your blood pressure and blood sugar, make those numbers go up, which can lead to worsening kidney function. So it's important to try and manage that as best as you can too. Okay, now Susan can come up and we'll talk about our available resources that we have and the support that we offer to you guys through the clinic.
I think I've met each of you, and I think all of you are in connected care management with us. Like I was saying, Christina is our wonderful clinical care advocate, and Margie works closely in the general care management population. But we consider each of you very valuable. I mean, that's kind of a basic principle of human respect is that each life and person is valuable. We know that, we get one physical body, we get one life to live, and we want you to be able to live your best life. I'm so glad, Janice, you were bringing up about kind of that perspective of it seems like I can't have anything, or it seems like I'm just seeing problems in front of me. But we believe that we can help to empower you to really change that perspective and to see the things that are out there that you can have, that you can do, because we want you to feel engaged and empowered as a patient and as start to become that your own self-advocate, like Dr. Almeida was saying. When you notice changes in your body and you know that something is not right, no matter what anybody else is telling you, when you know that something just isn't right with you, that's when you speak up for yourself. You tell that person. And we are part of that support system that you have in connected care to be able to tell about those new or worrisome things that are coming up. And we also want to help, prevent or slow that progression, of kidney disease. We know that that doesn't have to be this death sentence or life sentence that you live with, that there are things that you can do. There are things that are within your control. And who likes to be in control? I do. I like to have things in my life I can control. And one beautiful thing is that we are each given the power to have our own sense of self-discipline and control about our actions. So whose mama ever told them you're responsible for yourself? I preach that to my kid. And I have to tell it to myself too. So I know personally, even it can be really overwhelming to hear everything, to hear all the things you need or should be doing or shouldn't be doing. So what if you could just pick one thing this week or this month to focus on, and, make like a to-do list of all the things you do want to accomplish. I have food goals that I've made over the course of my life. Getting off the coffee creamer, that was one of my goals. And I'm here to say I came out victorious, but it was a process. I didn't just rip off the Band-Aid and stop it overnight. Yeah, I kind of weaned myself. Like, you can wean yourself. You can actually change the way your body views food. You can change the way your body craves certain kinds of foods. If you kind of have deemed yourself a sweet tooth, you have the power to change that. So it doesn't happen overnight, but you can.
I love the salt, and I just would salt my food before I would taste it.
Yep.
But I have really,
Yeah.
especially when I find out that I did, after food problem things.
And that's one of those things you can control. So we're here in connected care to be, that person that doesn't stand above you and bark orders, but we are here to link arms with you, and we're really just a text message away. So, we're not artificial intelligence. We are the real thing, real people on the other line, and we do really care. And we really are knowledgeable about your history and your background. We have that information there at our fingertips. So that in connection to your doctors, to nurses, where, we can help you get the answers. We may not always know the answer or have kind of that within our scope, but we know where to find the answers for you. And so we don't want you to be at the mercy of Google or the internet and, all the things out there. We want you to have a reliable source and not just a push of information, but somebody that's going to help you kind of figure out some of those, I call them life hacks. Like, okay, what can I do practically to make this easier? What does it look like for me to put this into practice? So if you maybe have been getting the text and you're like, I don't know who this is texting me, now you know. So we rely on your feedback. That really helps us to individualize things to you. Otherwise, we can't possibly know all the struggles or the barriers that you're coming up against in your everyday life. But if you can share those with us, we can help find a solution and something practical that can really take you to the next level. I mean, and before you know it, you're really leveling up with your health and your knowledge. And that's a really freeing feeling, to have that kind of knowledge. So if you have other questions about connected care, let me know. The number you get the text from, you can text that number at any time. And your care advocate can see that, or that's a direct line also to Bethany. We can put you in connection with her. And she's got a calendar that she keeps where she can make appointments one-on-one with you. If you have some other questions, you want to pick her brain and know about how this applies to you, she can help you out with that.
Yes. Thank you.
Yeah, but thank you all for coming.